Welcome back to the Gustavo Franco podcast. In today's episode, we're going to delve into the pressing issue of the mental health crisis gripping the U.S. With an increasing number of Americans seeking mental health services and a troubling rise in suicide rates, it's clear that our society is facing a significant challenge. From the escalating mental health struggles among our youth to the disparities in access and treatment based on race, income, and gender, we're going to explore the multifaceted aspects of this crisis. We'll also examine the impact of professions on mental health, the growing recognition of eating disorders among men, and the unique challenges faced by the LGBTQ+ community. This episode is going to serve as a holistic overview of the state of mental health in the US, and also as a starting point for future episodes that we're going to have with experts on specific mental health issues. First, let's lay the groundwork by defining what we mean by a mental health problem. Mental health issues encompass a wide range of conditions that affect a person's thinking, feeling, mood, or even behavior. They can be occasional or long-lasting, we say chronic, and can affect someone's ability to relate to others and function each day. The spectrum ranges from common disorders such as depression and anxiety to more severe conditions like schizophrenia and bipolar disorder. The demand for mental health resources has skyrocketed. Approximately 1 in 8 U.S. adults are now taking an antidepressant, and 1 in 5 have sought some sort of mental health care. This is an issue that's becoming more relevant in everyone's lives, and we've had an increase of nearly 15 million individuals receiving mental health care since 2002. A study in the JAMA Health Forum reviews that from 2019 to 2022, the use of mental health services almost spiked by 40% among U.S. adults with commercial insurance. Well, keep in mind, that's the period during COVID. This surge in demand is a clear indication of the deep impact that the pandemic has had on our collective mental well-being. Perhaps most disturbing is the substantial rise in suicide rates, which have surged by about 30% since the year 2000. Approximately a third of U.S. adults now report symptoms of depression or anxiety, 3 times the number from 2019, and only 31% of adults consider their mental health to be excellent, a decline from 43% 2 decades ago. Well, I think this is enough to show that mental health is a growing problem in our society. In nearly all aspects of mental health, we can see that we've worsened in the past few decades. So this is an issue that we all have to tackle together, and I hope that this episode gives everyone a more clear understanding of the landscape of mental health in the US. You are now listening to the Gustavo Franco podcast, where we challenge the norms and uncover the truths of our healthcare system. I'm your host, Gustavo Franco. Let's start with one of the topics that's making headlines everywhere and is also affecting millions of lives in the US, and that is the escalating mental health crisis amongst our youth. Recent data has shed light on the troubling state of youth mental health. In 2019, 1 in 3 high school students reported experiencing persistent feelings of sadness or hopelessness, marking a 40% increase from a decade earlier. Among female students, the situation is even worse, with half reporting these persistent feelings. Furthermore, hospitalizations for pediatric suicidal behavior have skyrocketed by 163% over an 11-year period from 2009 to 2019. Delving into the roots of this crisis, we can look at a longitudinal cohort study, which is a research method that follows a group of people over time to observe any changes and outcomes. This study has revealed a concerning trend amongst our youth. This study, involving 6,500 U.S. adolescents aged from 12 to 15, found that those spending more than 3 hours per day on social media, 3 hours per day, do you know how much that is? They were twice as likely to report poor mental health outcomes, including symptoms of depression and anxiety. Social media, while being a platform for connection and expression, also harbors dangers like cyberbullying, social comparison, and exposure to unrealistic standards. This raises the question, is there a direct link between excessive social media use and the mental health challenges that our youth are facing today? That's the question that we're all trying to answer, and we've been trying to answer it for a long, long time. But the truth is that mental health among the youth keep worsening and social media use keeps increasing. Addressing this issue requires a concerted effort. Parents, educators. If we want to address this issue, we need a concerted effort. Parents, educators, healthcare professionals, and policymakers need to work together to tackle this crisis. And today we're going to explore some strategies for mental health education, promoting open communication, setting guidelines for responsible social media use, and also enhancing access to mental health support services. It's unrealistic to say that we should stop using social media, right? But how can we use it in the healthiest way possible? On the topic of possible solutions, let's talk about a remarkable initiative out of the Sacapee Valley High School in Hiram, Maine, where teens are stepping up to support each other's mental health. The Sacapee's Yellow Tulip team was started by 17-year-old Cameron Barron. This student group devoted to mental health offers a platform for students to express and vocalize their concerns. They're like a school club, you know? The overall Yellow Tulip project was co-founded in 2016 by a resilient Maine high schooler, Julia Hansen, who faced the heartbreaking loss of her two best friends to suicide. And she has been able to expand the movement to multiple high schools in Maine. This nonprofit aims to destigmatize mental health illness and encourage students to prioritize their emotional well-being. At Sacapee Valley, the Yellow Tulip team begins every Monday. They greet students with upbeat music, incorporating positivity into the start of the week. Through morning announcements, they share vital mental health information to foster an environment of awareness and support. But perhaps the most significant takeaways from this initiative and a point of admiration is that it comes from a younger population. The youth, the people that are being affected the most in this country, they are stepping up for change. And that's really inspiring. Across the nation, we've seen teens stepping up to protect various social issues like climate change, and mental health is no exception. Now, let's turn to the other end of the age distribution by looking into a topic that's equally important but often overlooked, the mental health of older adults. Age, as it turns out, does not shield one from challenges of mental health. Let's start with numbers here again. About 20% of individuals aged 55 and over are battling with mental health issues. Anxiety, severe cognitive impairment, and mood disorders, including depression and bipolar disorder, are notably prevalent in this demographic. But perhaps the most alarming statistic is the suicide rate among older men, especially those aged 85 and older, which stands at 45.23 per 100,000 men. This is significantly higher than the overall rate of suicide, which is 11.01 per 100,000 people across all age groups. In our last healthcare news episode, we also talked about the rising rates of alcohol consumption in older Americans. It's been making headlines everywhere, but after the pandemic, older Americans have been turning to alcohol a lot more frequently. They do it as a way to combat loneliness, and they just say that they feel good doing it. But let's turn back and talk more about suicides amongst older adults. In the broader context of the US, more than half of firearm-related deaths are suicides, with over half of all suicides involving firearms. This method is even more common among older men, with at least 3/4 of suicides among men 65 and older involving guns in 2021. The availability of firearms in households, especially among seniors, coupled with the high fatality rate of suicide attempts using guns, paints a grim picture of the mental health crisis facing our elderly population. What's not surprising, but often overlooked, is that emotional and social support also play a pivotal role in mitigating mental and physical health risks, and even mortality. A vast majority of adults aged 50 or older, nearly 90%, reported receiving adequate support. But there are nuances to this. Adults aged 65 and older are more likely to report receiving insufficient support compared to those younger, with rates of 12.2%. So 12.2% of adults older than 65 say that they do not receive sufficient support. And gender disparities here are also super evident. Older men are more likely than women to report of lack of support. We need to understand these disparities so that we can tailor our support systems to the groups that need it the most. So how do we bridge the support gap? The solution lies in establishing better community programs, family involvement, and leveraging technology for social connectivity. But it also lies in combating general social images of masculinity, which suggests that men shouldn't be as vulnerable to mental health struggles. So we just talked about the old and the young, the elderly and the youth. So how do they really interact with each other? Can we talk about them together? And the truth is that intergenerational connections are now at an all-time low, even though they have a positive impact on mental health and general well-being. An example of that is Miami University's Opening Minds Through Art, or OMA, which is revolutionizing the way we think about aging and dementia. Since its inception in 2007, and with an innovative online version launched in 2022, the OMA has been fostering meaningful connections between students and older adults. Around 70 pairs have embarked on a creative journey through the video program, while another 73 students participate in arts activities with individuals experiencing dementia across various community settings. Through art, they find common ground, forming connections that transcend age and cognitive barriers. But why is this really so important? The answer lies in the shifting dynamics of our society. Most people find their social networks limited to those within a 10-year range, either older or younger. But factors such as early retirement and the decline of traditional social organizations have led to fewer and fewer intergenerational connections. The repercussions here of this age segregation are profound, especially when we consider the impact of ageism on health and older adults. Yale psychologist Dr. Becca Levi has research that has consistently shown that negative attitudes towards aging are linked to serious health risks, including cardiovascular events and psychiatric illnesses. It basically says that if we have a negative perception of aging, we actually age worse and we have worse health and mental health outcomes. Conversely, individuals with positive views on aging tend to fare significantly better in various aspects of health, from memory and hearing to even physical function. They even enjoy a longer lifespan. Intergenerational programs like the OMA are powerful tools in combating ageism. Studies have shown remarkable shifts in attitudes towards people with dementia among students who participate in these programs. They report increased comfort, affection, and engagement with the older adults that they collaborate with. These initiatives not only provide therapeutic benefits for those with dementia, but they also enrich the lives of the younger participants. And that right there is why intergenerational connections are so important. But let's shift our focus to drug abuse. Well, we all hear about drug abuse and the increase in drug deaths, drug overdose deaths. With mental health issues on the rise, we're also seeing rising rates of drug abuse. In 2020, nearly 92,000 Americans lost their lives due to drug overdoses, a staggering increase from around 70,000 in 2017. That's 22,000 more Americans dying in 2020 than in 2017 from drug overdose. This sharp rise reflects a broader, more concerning trend that has been developing over the years. According to the CDC, the rate of fatal overdoses jumped from 21.7 to 28.3 per 100,000 people during this 2017 to 2020 period. These numbers aren't just statistics. They represent lives, families, and communities torn apart by the devastating impact of addiction. The factors contributing to this surge are complex and multifaceted, from the increased availability of synthetic opioids like fentanyl to the challenges posed by the COVID-19 pandemic, which exacerbated feelings of isolation, anxiety, and depression, thereby increasing substance use as a form of coping mechanism. But what can be done to address this growing crisis? Improving access to treatment and recovery services and expanding education on substance use and its risks is just a part of it. How do we better regulate drugs from being illegally sold, and how do we ensure that those that are sold legally are not abused? I know this is a question that we're all trying to answer, and it's a top political concern right now, but these are also questions that we all have to keep on the top of our minds. Reducing the stigma around drug addiction and mental health is also crucial here. By fostering a more understanding and supportive environment, we can encourage those struggling to seek help without the fear of judgment and discrimination. This brings us to an increase in substance misuse among teenagers. A recent analysis by the CDC sheds light on a concerning trend. This study, drawing from over 15,000 health assessments of 13 to 18-year-olds seeking substance use disorder treatment between 2014 and 2022, reviews a startling reality. The primary reason most adolescents turned to drugs and alcohols was to find a sense of calm. An overwhelming 73% of the teens surveyed reported using substances to feel, quotes, mellow, calm, or relaxed. It's a stark reminder of the underlying mental health struggles fueling these decisions. Nearly half are trying to escape worries, bad memories, or the grips of depression and anxiety, and the consequences are dire. The CDC data shows a 109% increase in overdose deaths among adolescents from 2019 to 2021. Counterfeit pills, often laced with lethal substances, are implicated in nearly a quarter of these tragedies. Shockingly, in most of these overdose situations, there was a bystander present. Yet, in the face of this critical moment, most provided no response. It's a chilling reflection of either a lack of awareness or a paralysis in knowing how to act. And with naloxone sprays becoming more and more available, I really encourage everyone to have one handy because it can many times be a life-saving measure in many drug overdose situations. But now that we have an understanding of the landscape of the mental health crisis in the US, let's get into the potential causes of this crisis. In 2020, amidst the pandemic's peak, emergency rooms saw a 31% surge in visits related to mental health among adolescents aged 12 to 17. Each number in this statistic represents a young life overwhelmed by the pandemic's shadow, grappling with fear, uncertainty, and isolation. The pandemic saw measures of loneliness rise significantly. COVID wasn't just a virus to our doorsteps. It ushered in a wave of social stressors that have left indelible marks in our mental well-being. For many, the lockdowns meant not just confinement to our homes, but a disconnection from the outside world. A student missing their graduation walk, a grandparent witnessing milestones through a screen, and workers navigating the solitude of remote work. Each story is a statement to the profound ways our lives have been altered. The pandemic also magnified existing social pressures, job insecurity, educational uncertainties, and the relentless quest for a work-life balance in the ever-changing world that we live in. With the shift to online life, U.S. Surgeon General Vivek Murthy casts a spotlight on an issue that has had an impact on mental health since its start: social media use. In an era where nearly every teen has a digital window to the world in their pocket, a staggering 95% of them, aged 13 to 17, navigate through the realms of social media. But as these platforms become virtual extensions of their social lives, about a third of these young users find themselves entangled in a web of almost constant engagement. The Surgeon General's report eliminates a troubling link between social media use and deteriorating mental health among adolescents. A poignant example is the 2019 study that we mentioned earlier. It reviewed that teens dedicating more than 3 hours a day to social media had twice the risk of encountering poor health outcomes, including spikes in depression and anxiety levels. The sad truth is that the pandemic only made this worse, with people turning to social media to replace in-person interactions. Dr. Murthy's recent warning challenges us to confront a concerning trend. With a blend of urgency and caution, he states, quote, "At this point, we do not have enough evidence to say with confidence that social media is sufficiently safe for our kids." His words are a call for action, urging policymakers and guardians alike to establish safeguards against the tide of harmful content and the pitfalls of excessive digital consumption. Another potential cause for the rising mental health crisis in America is climate change. And it's a topic that we talked thoroughly in the February and March healthcare news because it's impacting lives worldwide. A recent study published by the Lancet Planetary Health has brought to light some concerning statistics. Led by researcher Hickman, the study surveyed 10,000 children and young adults across 10 countries. The findings: a staggering 59% of participants reported feeling very or extremely anxious about climate change, with more than 45% stating that this anxiety negatively affects their lives. But the issue doesn't end there. According to a related study in the Journal of Climate Change and Health, mental health professionals in the UK are also witnessing a marked increase in patients citing, quotes, climate change as a significant source of their psychological distress. This trend, they predict, is only set to continue, signaling a growing recognition of the mental health implications of our changing climate. The effects of climate anxiety can be profound, disrupting daily functioning and leading to feelings of isolation, deep worry about the future, and also intrusive thoughts concerning survival. It's a clear indication that the climate crisis isn't just an environmental issue. It's deeply intertwined with our mental well-being. In the face of this, the big question arises: what can we do to support those struggling with climate anxiety? Beyond advocating for environmental action, there's a need to foster open conversations about these feelings, provide resources for managing anxiety, and ultimately create a community of support that acknowledges and addresses these valid concerns. Once again, in the recent healthcare news episodes, we've seen an increase in therapy measures that use the outside world. Therapy is now happening at increasing rates in the outdoors. People are going to the outdoors to have their therapy with their therapists. And this is just one recent advancement to directly tackle and fuel the climate crisis during these therapy hours. Now let's change gears a little bit and dive into the world of outpatient mental health treatment, a crucial aspect of mental health care that offers a lifeline to many navigating the complexities of mental health conditions. Outpatient treatment offers a flexible yet structured approach for individuals who need support but cannot commit to residential care. Whether it's due to family responsibilities, work commitments, or the need for a gradual transition from inpatient care, outpatient services provide a vital bridge to recovery and management of mental health. This form of treatment caters to those with mild to moderate symptoms, offering everything from short-term counseling to long-term care plans, ensuring that each person receives the tailored support they need. It's the versatility of outpatient care that makes it so effective, allowing treatment plans to adapt to the unique needs of each patient. Outpatient treatment emphasizes the development of coping strategies and stress management skills, equipping each patient with the tools that they need to navigate their daily lives. For many, this includes learning how to manage their conditions in the context of their family dynamics, which is where family therapy comes into play, offering a comprehensive approach to mental healing. The array of services available is vast, including individual and group counseling, psychotherapy, psychiatric medication, and specialized therapies. These services address a wide range of conditions, from bipolar disorder and anxiety to depression and stress management. Let's get into what therapy really is. At its core, therapy, often referred to as psychotherapy or talk therapy, is about healing. It's a process where individuals work with a trained therapist in a safe, confidential space to explore feelings, beliefs, and behaviors. They confront challenging memories, identify aspects of their lives that they would like to change, and better understand themselves and others. They also set personal goals and work towards desired change. The journey of therapy is as diverse as the individuals who embark on it, from cognitive behavioral therapy, or CBT, which focuses on identifying and changing negative thought patterns and behaviors, to dialectical behavior therapy, or DBT, which teaches skills to manage emotions and reduce conflict in relationships. Therapy is tailored to meet the unique needs of each person. But therapy isn't just about addressing mental health conditions. It's also about personal growth. And that's why we're seeing more and more people going to therapy, even if they might not see themselves as having mental health struggles. Therapy helps strengthening coping skills and also improving relationships. Whether it's navigating life transitions, dealing with stress, or simply seeking a deeper understanding of oneself, therapy offers a path to resilience and emotional well-being. And because of all these benefits, therapy is becoming more and more popular, but also more widely accepted. And even many people that don't struggle with mental health, as I said, are partaking in therapy sessions to talk through life and stressors. Now let's look at inpatient mental health treatment, a type of mental health treatment that provides an intensive level of care, designed for individuals facing more serious mental health challenges. These challenges can range from manic episodes, severe depression, to self-harming behaviors and suicidal intent. It's a setting where safety and comprehensive care are top priorities. Innovative treatments, including art and music therapy, play a significant role in enhancing mental well-being within these hospitals. According to the severity of patients' mental health struggles, there are instances where people are involuntarily committed, a process where an individual is admitted to inpatient care against their will. It's initiated when a person is deemed a danger to themselves or others due to mental illness, and when they are unable to care for themselves. This involves a legal procedure where a police officer, doctor, care professional, or even family member requests their admission. Data in 22 states showed an average increase of 13% in yearly rate of people involuntarily committed to inpatient care from 2012 to 2016. With an increase in people being involuntarily committed to inpatient care, we need to bring awareness to the issue of lack of psychiatric beds. A report by the Treatment Advocacy Center highlighted a 14% decrease in psychiatric beds from 2005 to 2010, leaving only 14 beds available per 100,000 people. This shortage has profound implications, funneling individuals in need of intensive care into homelessness or, increasingly, incarceration. This points to a disturbing shift. A significant number of individuals requiring psychiatric care are now found in prisons, with the percentage of people with serious mental health illness in correctional facilities skyrocketing from 0.7% in 1880 to 21% in 2005. This situation highlights a pressing need for a comprehensive reevaluation of our mental health care systems to ensure adequate support and treatment, especially for those most vulnerable. Let's now turn our attention to medications, a major part of both inpatient and outpatient care. And I think it's also a really interesting topic for us all to talk about because it's becoming a bigger part of our rhetoric. I feel like I'm always hearing about a different mental health medication nowadays, and I think it's really interesting for us to understand what they really are. With a range of options available, understanding these treatments really is key. So let's dive deeper into the critical components of mental health care by discussing the most commonly used mental health medications. Let's start with selective serotonin reuptake inhibitors, or SSRIs. You've probably heard of SSRIs, and if you pay attention to the name that I said, it tells a lot about what it actually does. Once again, selective serotonin reuptake inhibitors. These medications are the most commonly prescribed antidepressants. SSRIs work by increasing serotonin levels in the brain. Serotonin, often referred to as the body's natural, quote, feel-good chemical, plays a vital role in mood regulation. By blocking the reabsorption of serotonin into neurons, SSRIs enhance communication between brain cells, focusing mainly on serotonin without affecting other neurotransmitters. It's important to highlight that SSRIs are not addictive. However, abruptly stopping antidepressant treatment or missing several doses can cause withdrawal-like symptoms, known as discontinuation syndrome. Now let's turn our attention to Adderall. This combination medication is mostly used to treat attention deficit hyperactivity disorder, or ADHD. It works by increasing levels of serotonin, dopamine, and norepinephrine. Dopamine is a neurotransmitter that is known as the reward center of the brain. It is responsible for giving you pleasure and focus. Norepinephrine is a neurotransmitter that regulates stress and attention. So you combine all of that with the serotonin that we already talked about, and you see a remarkable medication that is able to increase focus. Amphetamine, or dextroamphetamine, the class of drugs to which Adderall belongs, acts as stimulants. They can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. It's important to note that Adderall is one of the most commonly prescribed drugs in the country, but also one of the most abused. Moving on, benzodiazepines, such as Valium and Ativan, are depressants that can relieve anxiety, muscle spasms, and reduce seizures by slowing down the central nervous system. They can cause sleepiness, mood relaxation, and in some cases, amnesia or irritability. Alprazolam, commonly referred to as Xanax, belongs to a class of medications called benzodiazepines, which acts on the brain to produce a calming effect. Xanax is used to treat anxiety and panic disorders. It works by enhancing the effects of a chemical called gamma-aminobutyric acid. GABA is a natural chemical made in the brain, and some people even take it as a supplement. Though it helps many people, this medication sometimes causes addiction. This risk may be higher if you have a substance use disorder such as overuse or addiction of drugs and alcohol. Another notable medication is aripiprazole, also known as Abilify. This antipsychotic medication helps treat several kinds of mental health conditions, including schizophrenia, bipolar I disorder, autism, and Tourette's. Aripiprazole acts as a functional antagonist in areas of high dopamine activity, such as mesolimbic pathway, while remaining inactive in areas with normal dopamine activity. This dual action may be responsible for effectively managing a range of symptoms associated with these mental health conditions. It's clear that each treatment option carries its own set of considerations, from the promise of improved well-being to the need for cautious administration and awareness of potential side effects. These medications represent a complex but crucial part of mental health care, both for inpatient and outpatient cases. On the topic of medications, let's discuss the complexities and potential dangers of polypharmacy, a topic that we also mentioned in recent healthcare news. And this is the use of multiple medications in psychiatric treatment. Our discussion is inspired by a heart-rending story shared by a mother who lost her son, Bradley, a young man who was battling with anxiety, depression, and an eating disorder. Bradley's journey through mental health treatment led him down a path of polypharmacy, a common yet risky practice in psychiatric care. Bradley, only 21 years old, was on a regimen of various medications prescribed by multiple healthcare professionals. Tragically, he passed away in his sleep due to the interactions between these medications. His story is not just a private tragedy, but also a stark warning about the dangers of polypharmacy. In 2017, the same year that Bradley died, over 70,000 individuals in the U.S. succumbed to drug overdoses, a number that alarmingly climbed to over 100,000 by 2021. These figures highlight a growing crisis where the treatment meant to heal can sometimes actually lead to harm. The practice of polypharmacy underscores the importance of cautious medication management and the need for healthcare professionals to coordinate comprehensively. The system needs a more vigilant approach to prescribing mental health drugs, ensuring that the potential benefits of the medications outweigh the risks. There also needs to be better communication between providers to ensure that a patient isn't taking another drug that could react with a new prescription. Bradley's mother has since dedicated her life to advocating for safer mental health treatments and raising awareness about the dangers of polypharmacy. Her courage to share Bradley's story is also a powerful reminder of the need for change in how we approach mental health care and medication management. Bradley's story is becoming far too common recently. Let's look into a study published in the JAMA by researchers from the University of Maryland. This study sheds light on the growing practice of prescribing multiple psychiatric medications to children and adolescents. The study conducted among Medicaid-enrolled participants aged 17 and younger from 2015 to 2020 in an undisclosed U.S. state reviewed a 9.5% increase in polypharmacy. Interestingly, this practice was notably more common among disabled or foster care youths. While psychotropic medications can offer significant benefits, the researchers raised critical concerns. There is a troubling lack of safety testing and understanding of how these simultaneous medication regimens impact the developing brain of young individuals. Mental health experts acknowledge the potential merits of these medications and the discretion doctors must exercise in prescribing them. However, the use of unapproved drugs and the long-term effects of these combined medications on brain development remains obscure. This study highlights the need for careful consideration and further research into the practice of polypharmacy in pediatric mental health care. Now that we've talked about many ways to deal with mental health struggles, we need to discuss how people view different types of treatments. So let's start by looking into a topic that's both complex and crucial: public perception of medication for mental health issues. It's a conversation that challenges our understanding of treatment acceptance. The path to mental wellness is often paved with a variety of treatment options, each tailored to the individual's unique needs, as we talked about. However, a compelling study published by the American Psychological Association sheds light on a significant aspect of this journey: the choice between medication and psychotherapy alone. Researchers embarked on an exhaustive meta-analysis encompassing 186 studies focused on patients seeking mental health care. Their findings review a striking pattern. When treatment recommendations only included medications, patients were about twice as likely to refuse or prematurely terminate their treatment compared to treatment recommendations that only included psychotherapy. This tendency to choose only therapy over only medication was particularly pronounced among patients dealing with social anxiety disorder, depressive disorders, and panic disorder. The numbers speak volumes, with treatment refusal rates significantly higher for medications alone. This revelation prompts a deeper exploration into the reasons behind such decisions. What drives this preference for psychotherapy over medication? Is it the fear of dependency, side effects, or perhaps the deeper desire for a treatment that addresses more than just symptoms? Or could it even be the social perception of taking antidepressive drugs? These are questions that not only healthcare providers, but also we as a society need to contemplate. So on a similar topic, let's dive into the realm of holistic mental health care, exploring the various types of natural treatments. It's a journey through the mind, body, and soul, as we uncover the essence of treating mental health from a comprehensive standpoint. At the forefront of holistic mental health is the principle that we are more than just a collection of symptoms. Holistic practitioners advocate for a comprehensive view, considering mental, emotional, physical, spiritual, and social dimensions. It's about understanding the patient in their entirety, examining how lifestyle, relationships, and environmental factors intertwine to impact mental well-being. Holistic mental health care provides a patient a more personalized care plan. It can include increasing our exercise, eliminating artificial or ultra-processed foods, and socializing more. These lifestyle changes have the ability to improve a patient's mental health significantly. One natural remedy gaining attention recently, especially on social media, is ashwagandha. Rooted in ancient practices, this herb is celebrated for its stress-relieving properties. Clinical trials have begun to back up these claims, suggesting that ashwagandha extracts may indeed offer a beacon of hope for those battling with anxiety and stress. But more research is warranted here. Another natural remedy that has captured the interest of many is fish oil, rich in omega-3 fatty acids. A study dating back even to May 1999. There has been significant data here over the years, and even a study dating back to the May 1999 issue of the Archives of General Psychiatry reviewed that individuals with manic depressive symptoms experienced marked improvements when taking 10 grams of fish oil daily. Keep in mind that 10 grams is probably a lot more than we would consume, but it's an interesting study showing the potential benefits of omega-3 fatty acids. The B vitamins also have shown high hopes in helping with mental health, but more research is warranted there too. However, it's crucial to approach these findings with a balanced perspective. Recent research by a team of Massachusetts General Hospital and the Brigham and Women's Hospital indicates that fish oil supplements may not be as effective in preventing depression in the general population. While omega-3 supplements have been recommended for reducing depression recurrence in high-risk patients, there's not really a consensus that their use for depression prevention can be expanded or extrapolated at large, underscoring the complexity of mental health treatments. This conversation between natural treatments and medications isn't about choosing sides. It's about recognizing that mental health care is multidimensional and personalized. For some, traditional medications are life-saving. For others, natural remedies offer solace. The key is personalization, finding the right balance that honors the individual's needs and their preferences. Another way natural treatments are being incorporated in mental health care is changing the location of therapy sessions, as I mentioned earlier. Let's venture into the great outdoors and discuss a therapy that combines the serenity of nature while with the transformative power of talk therapy. Our story begins with a visit to Talmar, a unique setting where the healing embrace of nature is palpable. Talmar is not just any farm. It's a nonprofit sanctuary offering therapeutic programs and vocational training nestled in the heart of nature. Rachel Oppenheimer, a dedicated counselor at the Chesapeake Mental Health Collaborative, along with her clinical supervisor, Heidi Schreiber-Penn, ventured into this tranquil space to explore therapy beyond the conventional office setting. Immersed in the soothing sounds of nature, they practice therapeutic techniques that harness the natural world's innate healing properties. This method isn't new, but it's gaining traction among therapists who see the undeniable benefits of integrating nature and movement with traditional talk therapy. Dr. Schreiber-Penn, a pioneer of this movement, advocates for outdoor therapy sessions, believing that the combination of nature's calm and the act of moving can open doors to emotional healing. The premise is simple yet profound. Nature invites openness, brings out fresh perspectives, and encourages emotional expression. It also deepens our connection with the world around us. This approach to therapy transcends the conventional, offering clients a space where their thoughts and feelings can flow more freely, surrounded by the grounding presence of Earth. It's a testament to the therapeutic community's adaptability and commitment to finding pathways to healing that resonates on a deeply personal level. So we've talked a lot about mental health care, which in the US comes with many advantages. However, there are also a wide range of issues facing the mental health care system, and people of different backgrounds experience these issues differently. The US has a major issue of mental health care accessibility due to cost, despite the significant financial investments in treatment and services. First, let's talk why mental health care is expensive. One explanation for this is the issue of expensive medications. For many dealing with mental health conditions, medication is a crucial part of their treatment plan. However, the high cost of these medications, especially those not covered by insurance, can be a significant barrier to receiving effective treatment. And then there's the high demand and limited supply of mental health services. Across the nation, individuals are reaching out for help, only to find that the number of available professionals does not meet their need. This supply and demand imbalance not only makes it harder to access care, but also drives up the cost significantly. Mental health professionals, psychologists, psychiatrists, and counselors are the backbone of effective mental health care. Their extensive education and training are essential but come at a high cost. This investment in their professional development is often reflected in their fees, making specialized care less accessible for those who need it the most. Now, let's look at the numbers. In 2019, we spent a staggering $225 billion on mental health treatment and services in the US, a 52% increase from 2009. This investment underscores our society's growing recognition of the importance of addressing mental health challenges. This spending covers a wide range of treatments, including therapeutic interventions, prescription medications, and stays in psychiatric or substance abuse rehab facilities, reflecting a commitment to diverse treatment modalities. Despite this significant financial commitment, a recent survey from the University of Chicago paints a concerning picture. Among insured Americans under 18 seeking behavioral health care between January 2019 and April 2022, a shocking 69% did not receive the necessary treatment. This issue isn't limited to the younger population. The same survey reviews that 57% of adults seeking behavioral health care reported receiving no treatment at all. This gap between the demand for mental health services and the actual provision of care highlights the need for a more accessible mental health care infrastructure. There's an urgent need for advocacy, policy reform, and community-based initiatives to bridge this gap in mental health care access. Ensuring that individuals, regardless of age, can access timely and appropriate mental health support is crucial for our society's well-being. While we made strides in recognizing and financially supporting mental health challenges, there's still a long way to go in making sure that care is accessible to everyone who needs it. The lack of access comes with a great deal of financial losses. A recent study from the Indiana University Richard Fairbanks School of Public Health has put a price tag on this issue. Untreated mental health costs a staggering $4.2 billion in Indiana alone. First, let's address the more harrowing cost: premature mortality, meaning deaths before the average age of death in a country. And this accounts for over $1.4 billion of that $4.2 billion that we talked about. These are not just numbers, they represent lives lost too soon, underscores the urgent need for accessible mental health care, and it's a stark reminder of the human cost behind these figures. The economic impact extends beyond the invaluable loss of life. It extends to productivity losses, estimated at $885 million in Indiana alone each year. This encompasses the broader economic effects, including missed workdays and decreased productivity. This study also casts light on the other significant costs, such as direct healthcare, incarceration, and homeless shelter expenses, each contributing to the overall financial burden. When discussing the cost of mental health care, it's also important to understand how different income levels are impacted by mental health, especially the lower income bracket, which suffers greatly with the opioid crisis. Recent studies shed light on a worrying trend. Individuals living in poverty are significantly more likely to experience mental health problems such as schizophrenia, depression, anxiety, and notably, substance misuse. The relentless cycle of poverty exacerbates feelings of worry, nervousness, anxiety, and creates a situation for substance dependence. The opioid crisis has seen a worrying shift with the rise of substances like fentanyl and increased polysubstance use. This change has also led to a spike in overdose deaths, particularly among those of lower socioeconomic status. A recent study has revealed startling differences in overdose death rates based on education. In 2021, individuals without any college experience faced overdose deaths 9 times higher than those with bachelor's degrees. This data is a clear indicator of how educational background significantly influences the risk of overdose-related fatalities. Between 2019 and 2021, there was a dramatic increase in overdose death rates among those without any college education. Delving deeper into the demographics, the study further unveils that 31% of opioid overdose victims live at or below the poverty line. Furthermore, those not in the labor force constitute 47% of overdose deaths, while individuals without a high school diploma and those without any college education represent 24 and 35% respectively. However, as surprising as it may seem, money and privilege do not shield against depression, anxiety, or substance abuse. The assumption that affluence equates to happiness is debunked when we look closely at the lives of children from affluent families. The pressures of success, academic achievement, and living up to an idealized image can weigh heavily on young shoulders. A study focusing on upper middle class youth initially sought to compare these teens with their inner city counterparts. What researchers found was startling. These, quotes, privileged kids were struggling significantly more with substance abuse, depression, and anxiety. Despite the advantages of wealth and resources, these teens faced unique pressures that contribute to their mental health struggles. The drive to excel in academics, extracurricular activities, and social standings create a high-stress environment. This pressure cooker of expectations can lead to unhealthy coping mechanisms, including substance abuse, as teens strive to navigate this complex world. So, what can be done? Recognizing that mental health issues do not discriminate based on socioeconomic status is a start. For parents, educators, and policymakers, creating spaces for open conversation, reducing stigma, and offering support are critical steps towards addressing these challenges. Let's shift our focus to talk about how your profession can impact your mental health. Different professions have a track record for different mental health struggles. So let's discuss this by looking at the mental health challenges faced by individuals in high-stress professions such as medical professionals and construction workers. Medical professionals, including doctors and residents, face daunting mental health challenges. A meta-analysis shows that 29% of medical residents experience depression, significantly higher than the 8% for the general population. Physicians often suffer in silence due to the stigma and fear of professional repercussions. This is compounded by the stress of long hours, high responsibilities, and the emotional weight of patient care. The COVID-19 pandemic has further intensified the mental strain on healthcare workers, especially amongst emergency care physicians. In October 2020, 87% of health professionals reported increased stress levels due to the pandemic, yet nearly half are uncomfortable seeking mental health treatment. This brings light to the need for destigmatized mental health care within the medical community. Shifting focus to another profession, let's examine the mental health challenges faced by individuals in the construction industry and the struggles of CEOs. Recent findings by the American Psychological Association spotlight a concerning trend. Construction workers are significantly more likely to endure mental health problems compared to those in other sectors. The demanding nature of their work, coupled with job insecurity and hazardous conditions, paints a stark picture of the challenges they face daily. On the flip side, the corporate world is not immune to mental health issues. A revealing study showed that a staggering 49% of CEOs report suffering from a mental health condition. The relentless demands, coupled with the pressure to appear in control, have led many to experience overwhelming fatigue, stress, and a sense of being perpetually overworked. These findings shed light on a broader issue that transcends industries and job titles. From the construction sites to the boardrooms, mental health remains a critical concern that demands our attention and action. And now let's talk about race, because if you've listened to my episode with Dr. Christopher King, you know that systemic racism is everywhere in our healthcare system. it's important to look into how mental health impacts people of different races differently. Let's start by looking at Hispanic and Latino teenagers. They have the lowest rate of treatment for mental health. This can be due to the alarming fact that between 2014 and 2019, we've seen a drastic 17.8% reduction in mental health facilities offering services in Spanish. While the Hispanic population grew across all states, the availability of these services in Spanish declined in 44 states. In addition to Hispanic and Latino teenagers, Black teenagers are also facing concerning mental health issues. The CDC reports a 36.6% increase in suicide rates among Black teenagers, a number that outpaces other ethnic groups. Tragically, Black children under 13 are nearly twice as likely to die by suicide than their white peers. Behind these numbers lies a deep-rooted stigma surrounding mental health and systemic barriers that make accessing care a daunting task. But the challenges don't end there either. The majority of mental health clinicians in the US are white, posing a significant barrier for Black Americans in finding culturally competent care. This lack of representation and understanding is a critical issue, especially when addressing racial trauma, which is a stark reality for many Black teenagers. To further understand the mental health concerns of different races, we must look into the issues happening in America that can have a negative impact on mental health. This brings us to the groundbreaking study that sheds light on the intersection of public health, race, and policing in America, a collaborative effort by public health researchers from various universities and the National Institute of Health has brought forward compelling findings. Their research aimed to understand if unequal exposure to police violence contributes to racial disparities in sleep patterns. Recognizing that incidents of police violence could lead to heightened hypervigilance, worry, and post-traumatic stress among affected communities. The team assessed how police killings of unarmed Black individuals affected the sleep of both Black and white individuals over time. The results were clear. Black individuals consistently reported experiencing significantly lower levels of sleep quality following these incidents, regardless of their proximity or the media coverage they received. Interestingly, the researchers observed minimal impacts on the sleep patterns of white individuals, pointing to a deeper conversation about the human inclination to perceive events through the lens of personal relevance. These findings highlight how such disparities impact one's outlook on their own future and that of their family. This research demonstrates the pervasive effects of systemic racism, extending beyond immediate physical harm to influence the very rest and rejuvenation of communities. It calls for a broader understanding of the toll of police violence on the mental and physical health of Black Americans. Turning our attention to the issues Asian Americans face, the disparities are equally troubling. In 2019, Asian American teenagers in grades 9 through 12 were 30% more likely to consider suicide compared to their white counterparts. Yet, in a stark contrast, Asians overall were 60% less likely to have received mental health treatment in 2018. This gap highlights the urgent need for tailored mental health interventions that address the unique challenges of the Asian American community. The Indigenous Americans also suffer. Their mental health struggles as teenagers are deeply intertwined with historical, economic, and cultural factors. Despite suicide rates mirroring those of whites, the suicide rate among 15 to 19-year-old Native and Indigenous teenagers is more than double that of their white peers. To add to the complexity, economic barriers due to high levels of poverty create obstacles in getting mental health treatment. The scarcity of programs and providers sensitive to Native and Indigenous culture further hinders access to much-needed care. the mental health disparities among teenagers of color in the US paint a picture of a system in dire need for change. It calls for dismantling systemic barriers, increasing culturally competent mental health services, and destigmatizing mental health challenges within these communities to combat systemic racism. Now let's delve into a critical yet often overlooked aspect of mental health: the distinct ways mental disorders affect women and the unique challenges that they face. From hormonal fluctuations to societal issues, let's uncover the intricate relationship between gender and mental health. First, it's important to acknowledge that mental health disorders don't impact everyone equally. Women, for instance, are more susceptible to certain conditions like depression, anxiety, and eating disorders. These vulnerabilities can be attributed to a mix of biological, social, and psychological factors, including hormonal changes that women experience at various life stages. Consider the profound impact of hormonal fluctuations on women's mental health. During or after pregnancy, around menstruation, and throughout menopause, some women may encounter severe symptoms of depression. These conditions, perinatal depression, premenstrual dysphoric disorder, and perimenopause-related depression, highlight the complex interplay between hormonal changes and mental well-being. Suicide rates also tell a gendered story, with women attempting suicide more frequently than men. There are about 3 female suicide attempts for every 1 male suicide attempt. However, women typically do not use more lethal methods such as using a gun, so they actually die by suicide less than men, even though they have more attempts at suicide than men do. Violence against women further compounds their mental health crisis. Approximately 1 in 3 women have suffered from sexual violence, physical violence, and or stalking by an intimate partner. This exposure to violence not only leads to immediate physical harm, but also long-term psychological trauma, contributing to a higher incidence of PTSD, depression, and anxiety among survivors. Disparities in treatment access exacerbate these challenges. Latina and Black women, for instance, are significantly less likely to start treatment for maternal depression compared to their white counterparts. This gap underscores the urgent need for culturally sensitive and accessible mental health services that address the barriers these women face. But men also face many issues of their own. Call it the silent crisis of mental health among men. Despite societal strides toward gender equality, there remains a stark disparity in how mental health issues are perceived and addressed between genders. Let's dive into the complex world of men's mental health. According to the CDC, men are more likely to die by suicide than women. This grim statistic is a stark reminder of the profound mental health challenges many men face, often in silence. Digging deeper, research reveals a troubling trend. Men are significantly less likely to seek out mental health services compared to women. This reluctance isn't just about pride or societal expectations. It's a manifestation of deeply ingrained cultural norms that equate vulnerability with weakness. But at what cost? The physical and psychological toll on men who neglect their mental health is both profound and far-reaching. Why this disparity? The reasons are multifaceted. Stigma, societal expectations, and a lack of awareness all play a role. Men are often conditioned to not seek mental help, a mindset that not only jeopardizes their mental well-being, but also reinforces the cycle of silence and suffering. The consequences of this disparity extend beyond individual. Families, communities, and workplaces all feel the ripple effects of untreated mental health issues. It's a cycle that perpetuates itself, with each generation inheriting and reinforcing these harmful norms. So what can be done? Breaking the silence is the first step. We need to create spaces, both physical and metaphorical, where men feel safe to express vulnerability, to seek help without fear of judgment, It's about changing the narrative one conversation at a time. A major part of changing the narrative is expanding our knowledge on mental health disorders that are usually restricted to female patients. Let's look into a topic that's been gaining crucial recognition in the field of mental health: eating disorders amongst boys and men. A condition that transcends gender, challenging preconceived notions and broadening our understanding of body image issues. Historically, eating disorders were predominantly associated with women and girls, partly due to diagnostic criteria that included factors like the absence of menstruation. But the narrative is changing. Since 2013, there has been a significant shift in recognizing that men and boys are not immune to these eating disorders. Experts are now delving deeper into understanding how these conditions manifest differently across genders. Interestingly, the struggle for many males isn't solely about weight loss. It's about achieving a certain physique, one that's bulkier, more muscular. Research shows that 1/3 of teenage boys in the US are on a quest for muscle gain. But this quest, for some, veers off into dangerous territory, leading to eating disorders or muscle dysmorphia, a condition fraught with psychological distress and physical complications. Muscle dysmorphia, sometimes known as bigorexia or reverse anorexia, is particularly concerning. Individuals afflicted by this condition perceive themselves as never muscular enough, even when they appear fit and athletic to the outside world. This highlights the complex nature of body dissatisfaction and underscores the need for specialized approaches in treatment and support. The evolving understanding of eating disorders among males is a call to action for both the public and professionals. It's a reminder that body image issues know no gender boundaries and that everyone deserves access to the care and support that they need. Another critical issue in mental health care are the challenges faced by the LGBTQ+ community. LGBTQ teens are 6 times more likely to experience symptoms of depression than their non-LGBTQ peers. The situation grows even more concerning when we consider the rates of suicide within this community. LGBTQ youth are more than twice as likely to feel suicidal and over 4 times as likely to attempt suicide. These numbers underscore the dire need for supportive and inclusive environments. Transgender adults face their own profound challenges, with 48% reporting that they have considered suicide in the last year. This is a stark contrast to the 4% of the overall population, highlighting the critical mental health needs within the transgender community. So why do we see such pronounced mental health challenges within the LGBTQ+ community? The answer lies in a complex web of societal stigma, discrimination, and lack of support. These individuals often face rejection from family and society, bullying in schools, and marginalization in various aspects of life. Such experiences can lead to feelings of isolation, low self-esteem, and trauma, contributing significantly to mental health issues. Despite the clear need for specialized support, a recent study paints a concerning picture of the resources available. Fewer than 1 in 3 mental health facilities in the US offer specialized LGBTQ services for adolescents. This scarcity highlights a broader issue of accessibility and underscores the urgent need for mental health services that are not just inclusive, but also profoundly understanding of the unique experiences of LGBTQ+ individuals. While it's important to discuss the issues with mental health care in America, it's also important to shed light on positive changes. Americans' evolving attitude towards mental health disorders and the potential for recovery is moving in the right direction. In a significant shift from past sentiments, a survey conducted by the American Psychological Association reveals a promising trend. An overwhelming 87% of American adults agreed that having a mental health disorder is nothing to be ashamed of. This marks a pivotal change in societal attitudes signaling a move towards greater acceptance and understanding. Even more encouraging is the fact that 86% of those surveyed believe in the possibility of recovery for individuals with mental health disorders. This belief in recovery is crucial. It not only empowers those struggling with mental health issues, but also emphasizes the effectiveness of treatment and the importance of seeking help. These findings underscore a collective shift towards destigmatized mental health issues and recognizes them as a crucial aspect of overall well-being. It reflects growing awareness and a more compassionate, informed approach to mental health in our society. Teletherapy or mental health apps are a new way to navigate mental health care for people that might not be comfortable going in person. They offer a discreet, accessible way to access support, breaking down barriers that many face in reaching out for help. The convenience of receiving care from the comfort of one's home without the fear of judgment has made these digital solutions a preferred choice for countless individuals. But it's not just about overcoming stigma. Digital care options are effectively extending the capacity of health and social services. With a few clicks, individuals can access therapy sessions, mental health assessments, and a range of support services. This scalability is crucial, especially in times when the demand for mental health support has surged to unprecedented levels. Popular music is also reflecting the shift in how we discuss and deal with mental health. Let's explore an evolving narrative in pop music, a narrative that's increasingly embracing the complexities of mental health. It's a fascinating change where lyrics convey topics that were once considered taboo, from panic attacks and PTSD to therapy and the use of medication. One striking example comes from Dr. Jesse Gold, a psychiatrist at the University of Tennessee Health Science Center. Dr. Gold often refers her college student clients to the song Anxiety by rapper Logic. Why? Because it paints a vivid picture of a panic attack. It's a powerful testament to the role that music can play in understanding and expressing mental health issues. But why did this trend begin? Alex Kresovich, a scholar in mental health and pop music, points out to Kanye West's 2008 album as a pivotal moment. Kanye discusses his grief and depression, marking the start of what's now known as emo rap. According to Dr. Kresovich, it's not just that these songs exist, it's that they're dominating the charts. He examined top 25 rap songs over 2 decades and uncovered a significant, steady increase in references to mental health. This is a reflection of a broader societal shift towards openness and awareness of mental health issues. Not only are attitudes towards mental health improving, but the use of technology is also improving mental health care. This brings us to the fascinating development of the role of artificial intelligence, or AI, in psychiatry. Can AI transform the way we diagnose and treat mental health issues? Let's dive into the latest findings and what they mean for the future of mental health care. The human touch has long been considered irreplaceable in psychiatry, where personal interactions play a crucial role in diagnosing and treating mental health conditions. Yet, recent advancements in AI suggest we might be on the cusp of a significant shift. A collaboration between IBM and the University of California has uncovered that machine learning can predict and classify mental health problems with astonishing high accuracy. From suicidal thoughts to depression and schizophrenia, AI's potential to revolutionize mental health care is becoming increasingly evident. It works by using machine learning algorithms that considers information such as hereditary qualities, clinical history, way of life, and treatment reactions. By investigating this information, artificial intelligence can recommend custom-made mediations, upgrading the adequacy of treatment systems. But what does this mean for the traditional psychiatrist-patient relationship? If AI can enhance our ability to diagnose and treat mental health conditions more efficiently, and perhaps at a lower cost, are we facing a future where technology could partially replace human interaction in mental health care? It's a complex question, one that balances the benefits of technological advancement against the value of human connection. Moreover, research from Vanderbilt University Medical Center has presented groundbreaking findings using hospital admission data, demographic information, and clinical records. Machine learning algorithms predicted with 80% accuracy whether an individual might attempt suicide. This level of precision in early detection could save countless lives, providing crucial intervention opportunities before it's too late. As we ponder the implications, it's clear that AI in psychiatry presents both challenges and opportunities. The potential for dehumanization in psychiatry is a concern. Yet, if AI can deliver positive outcomes for patients, making mental health care more accessible and affordable, the trade-offs may very well be worth it. But considering all the innovations and positive changes in mental health care in America, it's important to also see where America stands on mental health care by drawing comparisons between the US and various other countries, focused in Europe. So let's shed light on the challenges and differences between mental health treatment accessibility. The US faces a stark reality when it comes to mental health care: a relatively low supply of mental health workers, notably psychologists and psychiatrists, compared to demand. In fact, only 1/3 of US primary care practices include mental health professionals on their team. This is a stark contrast to countries like the Netherlands and Sweden, where the figure exceeds over 90%. Moreover, the US grapples with a higher prevalence of lower treatment rate of serious mental illnesses than several other developed nations. This discrepancy highlights a significant gap in accessibility and provision of mental health services, a challenge that's not unique to the US, but is felt across the globe. In the European Union, for instance, individuals seeking psychological treatment face their own set of hurdles. Long waiting lists, high fees, and bureaucratic obstacles that often make timely and affordable care unattainable. This mirrors the accessibility challenges faced in the US, underscoring a common issue in mental health care provision on both sides of the Atlantic. Now let's touch on a topic that's as sensitive as it is divisive: assisted suicide for mental health disorders. In the US, no state permits physician-assisted death for these conditions, reflecting a cautious approach towards end-of-life decision related to mental health. Contrast this with Switzerland, a country with a markedly different stance. Switzerland views non-medicalized assisted dying as a civil right, even in non-terminal situations. This perspective has fostered a robust debate on the nature of suffering and the rights of individuals to choose assisted dying. The Swiss Academy of Medical Sciences recently revised its end-of-life policy to include intolerable suffering due to severe illness and functional limitations as a criterion for assisted dying, provided it's acknowledged by a physician. Interestingly, Switzerland has become a destination for what's been termed, quote, death tourism, attracting individuals from around the world seeking assisted dying options. In 2018, it's reported that over 90% of their members were foreigners, highlighting the country's unique position in the global discourse on assisted dying. This brings us to the future of mental health care. Let's dive into the transformative strides and future pathways in mental health care within the US. As we navigate through these crucial improvements, we uncover how they pave the way for a more robust and inclusive mental health system. A pressing issue at the heart of our discussion is the stark barriers to accessing mental health services. It's an uneven landscape, with urban and rural disparities creating significant hurdles. Addressing these gaps requires a concerted effort to ensure mental health services are within reach for everyone, regardless of where they live, their race, their gender, or their income. One innovative approach to bridging this gap lies in integrating mental health services into primary care. Imagine a scenario where mental health care is a seamless part of your regular health checkups. This not only normalizes mental health discussions, but also ensures an early detection and intervention, which are key to effective treatment. But let's talk about the elephant in the room, stigma. Despite advances, the shadow of stigma still looms large over mental health. Expanding educational initiatives and fostering an environment of openness can change the narrative, encouraging people to seek help without the fear of judgment. Turning our attention to the professionals behind the scenes, it's clear that a shortage of mental health experts is a critical bottleneck. Investing in the next generation of psychiatrists, psychologists, and counselors through incentives and robust training programs is essential for building a capable workforce ready to meet the growing demand. In the age of digital innovation, telehealth emerges as a beacon of hope. The expansion of telehealth services has the potential to revolutionize access, making mental health care more accessible, especially for those in remote or underserved communities. It's about bringing care to the patient, wherever they may be. Lastly, we cannot overlook the importance of insurance coverage in mental health care. Ensuring that mental health services are covered comprehensively and on par with physical health is crucial for breaking down financial barriers to access. As we wrap up today's episode, it's clear that the path to improving mental health care in the United States is multifaceted. From reducing barriers to access and integrating services into primary care to combating stigma and leveraging technology, each step forward brings us closer to a future where mental health care is accessible, inclusive, and integrated into our everyday lives. So with all of that in mind, it's evident that tackling this issue requires a multi-pronged approach that addresses the root causes and offers comprehensive solutions. Throughout our discussion, we've seen the importance of destigmatizing mental health, enhancing accessibility to care, and recognizing the unique challenges faced by diverse populations. The stories we've shared and the data we've examined paint a picture of a society in urgent need of reform and compassion. Moving forward, let's each play our part in advocating for better mental health policies, supporting those around us, and fostering a culture that values mental wellness as much as physical health. Thank you for joining us. And last but not least, I would like to thank our researcher Asiya Saeed for researching and helping prepare this episode. Remember, the journey to better health and a deeper understanding of medical science is ongoing, and each one of us plays a part in it. Stay curious, stay informed, and most importantly, stay healthy. Thank you for tuning in to this episode of the Gustavo Franco podcast. We hope our exploration of the world of healthcare has been insightful and thought-provoking for you. The opinions expressed here are ours and of our guests, and should not be considered professional advice. This podcast is a collaborative learning experience for both the producers and listeners. While we strive to convey accurate and up-to-date information, we acknowledge that our research may have limitations. We encourage all of our listeners to supplement their knowledge by conducting their own research. If you enjoyed this episode and want to stay up to date on our future releases, make sure to subscribe or follow us on your preferred podcast platform and social media. We highly value your feedback, so please don't hesitate to reach out with your thoughts, questions, or suggestions for future topics. Together, we can foster a more educated America and contribute to a more effective healthcare future. Thank you for joining us on this healthcare exploration.